In the first position of the discus throw, starting at the top of the body, when the discus is brought up, your deltoid is crossed over the front of your chest. Your deltoid is located at the spine of the scapula, is inserted at the deltoid tuberosity of the humerus, and extends and flexes the arm. Your rhomboid major and minor muscles are slightly stretched along with your deltoid. Your right hand is pronated on top of the discus, putting a slight strain on your latissimus dorsi. Your biceps brachii and brachialis help pull the discus up across your body. Your biceps brachii is by the tubercle above the glenoid cavity of the scapula. It is inserted at the radial tuberosity of the radius and flexes the elbow. Your right tricep is elongated as we bring the discus toward our left shoulder. Your left elbow, which is a hinge joint, is in flexion. That hand is supinated to hold the discus, putting a slight strain on your palmaris longus and brachioradialis. 2 fingers are grasping the edge of the discus, using your extensor digitorum muscles. The extensor digitorum is by the lateral epicondyle of the humerus, is inserted in the posterior surface of phalanges in fingers 2 to 5, and helps extend fingers. Your right foot rests on the phalanges and metatarsals in plantar flexion, and your left foot is planted on the ground. Your gastrocnemius is flexed, as well as your gluteus medius, because you are slightly on your toes. Your gluteus medius is at the lateral surface of the ilium, is inserted at the greater trochanter of the femur, and abducts and rotates the thigh medially. Your right vastus lateralis carries out the same type of movement in this position.
As we move into phase 2 of the throw, you will notice that your upper body is turned over your right leg, twisting the external obliques. The latissimus dorsi is stretched in this position, as well as your sternocleidomastoid because of the rotation that has taken place. Your left arm dangles with no muscles being activated, but your right arm is stretched back as far as possible behind your body. The pectoralis minor is the muscle with the greatest strain in this position. This muscle is at the sternal ends of your upper ribs, is inserted at the coracoid process of the scapula, and it pulls the scapula down and forward. Your triceps brachii work hard to keep your arm behind the rest of your body. Your triceps brachii are located at the lateral and medial surfaces of the humerus, is inserted in the olecranon process of the ulna, and extends the elbow. Since our hand is supinated, the weight of the discus strains the bicep. The shoulder is stretched back, straining the deltoid. The right hand is supinated, holding the discus, which therefore causes the radius to cross over the ulna. The palmaris longus has a pull on it from the weight of the discus. The palmaris longus is located at the medial epicondyle of the humerus, is inserted at the fascia of the palm, and helps to flex the wrist. The same type of weight is placed on your brachioradialis and on the opposite side of the extensor digitorum. Your weight is on the phalanges and metatarsals of your foot. It is in eversion. There is pressure on your right quads, primarily your vastus lateralis and vastus intermedius. Your vastus lateralis is at the greater trochanter of the femur, is inserted at the patella, and helps extend the knee. The outside calf muscle, your fibularis longus, is also used in this position.
In the final step of the throw, your deltoid moves your upper arm across your body as the discus leaves the hand. Your deltoid is located at the spine of the scapula, is inserted at the deltoid tuberosity of the humerus, and abducts and extends the arm. Your left arm is bent at the elbow on a hinge joint, causing your biceps to be gently flexed, just enough to keep the left arm held in place. Your right arm is held straight out, starting to pronate. You can feel a strong stretch on your pectoralis minor and biceps brachii. Your pectoralis major helps generate power to your arm to throw the discus. This muscle is at the clavicle and scapula, is inserted at the intertubercular groove of the humerus, and flexes and adducts the arm. Your biceps brachii are located by the coracoid process and tubercle above the glenoid cavity of the scapula. The muscle is inserted at the radial tuberosity of the radius, and it flexes the elbow and rotates the hand laterally. As the discus leaves your hand and your forearm bends slightly, the pronator teres is used. Your triceps complete the movement of throwing your arm. To make the discus spin off your fingers, you use your flexor carpi radialis and brachioradialis to get the last good push. The palmaris longus also helps push the discus all the way through your fingers. The palmaris longus is at the medial epicondyle of the humerus, is inserted at the fascia of the palm, and flex the wrist. The weight is distributed evenly on both legs, centered over the hips. Your left leg is straightened for support. Your right toes have rotated into plantar flexion, which puts strain on the outside quad, the vastus lateralis, and right over the knee on the rectus femoris. Your vastus lateralis is located at the greater trochanter and posterior surface of the femur, is inserted at the patella, and extends the knee. Your abdominal muscles are stretched back slightly, flexing your rectus abdominis. This completes the movement of the discus stand throw.